Hello everyone, today we are going to learn the complete step-by-step procedure of urinary Foley catheter insertion for both male and female patients. We insert a Foley catheter in conditions such as acute or chronic urinary retention, accurate urine output monitoring in ICU or postoperative patients, prolonged surgeries, neurogenic bladder, spinal cord injury, or severe incontinence, while contraindications include suspected urethral injury, blood at the meatus, acute prostatitis, or patient refusal. Before starting, always perform hand hygiene, wear PPE, take informed consent, explain the procedure to the patient, and ensure privacy. The required equipment includes a sterile Foley catheter, 12 to 14 French for females and 16 to 18 French for males, along with sterile gloves, drapes, antiseptic solution, water-soluble lubricant, 2% lignocaine jelly for males, a 10 ml syringe with sterile water, a urine drainage bag, and a kidney tray. For female catheterization, place the patient in the dorsal lithotomy position, apply sterile drapes, separate the labia minora with the non-dominant hand, clean the urethral area with betadine front-to-back strokes, lubricate the catheter, identify the urethral meatus just above the vaginal opening, insert the catheter about 5 to 7 centimeters until urine flows, inflate the balloon with 10 milliliters of sterile water, and gently pull back to confirm placement. For male catheterization, place the patient supine with legs apart, retract and hold the foreskin with the non-dominant hand, clean the glands and meatus in circular motions, instill 10 to 15 milliliters of 2% lignocaine jelly slowly into the urethra and wait 2 to 3 minutes. Hold the penis at a 90-degree angle to straighten the urethra. Gently advance the catheter about 20 to 25 centimeters until urine flows, inflate the balloon with 10 milliliters of sterile water, and bring the foreskin back to prevent paraphimosis. After insertion, secure the catheter to the thigh to avoid traction, keep the drainage bag below the bladder level, collect the initial urine sample if required, and document the catheter size, balloon volume, residual urine, and patient tolerance. Common complications include urinary tract infection, bleeding, urethral trauma, false passage, and paraphimosis, which can be minimized with strict aseptic technique. For removal, completely deflate the balloon and gently withdraw the catheter while asking the patient to cough. Thank you for watching, and don't forget to like,